Here in the Wakiso districts, where we know, of course, today is the World Eye Day, where, of course, the eyes need to be given attention, and of course, it is on a theme that love your eye, and we know very well that there have been concerns, especially raised from the past, on the low number of personnel in different government hospitals that take care of, that treat the eyes, and this has not been an exception of the remarks that have just been made here. What you're seeing behind me now, some of the Ministry of Health and other government officials giving speeches, talking about the same concept, and the remarks they have made, of course, that even if the National Medical Stores distributes government medical supplies, the eye, equipment, eye medicines, eye kind of, what it uses is not part of what they distribute, and that's part of the conversation. But of course, I want us to just get a perspective of what this whole entails, and on such a day, what people should know about caring for their eyes. Let me speak to one of the specialists to just give us that perspective. Good afternoon and welcome with me on Entebbe 1.
Good afternoon.
Yes.
Good afternoon, viewers.
Yes.
I'm Dr. Geoffrey Wabulembo. Yes. I'm an eye specialist. I work for Light for the World as the International Medical Director for Eye Health and Neglected Tropical Diseases. Yes. We are here at Entebbe celebrating World Sight Day as a national activity. World Sight Day is an annual event every second Thursday of October. Globally, there is a celebration of vision. Okay, you have been here for close to 2 weeks. You're screening, I'm told you, over 300 people, and 70 elderly people have been found defective to eye challenges and have undergone operation. 17 children. What is the magnitude of this in two communities?
Do you remember?
Yeah, the problem of eye health in the community is a big one. But there is another issue that many people may not know where to go if they have eye health issues. The other problem is that even those who have eye health issues, some of the treatments are costly and they may not be able to afford them. So when there are opportunities for free care, free eye health care, we tend to get these big numbers.
The remarks we have had here is that there is still a low number of specialists, eye care specialists in the country. How can this be overcome, maybe, if you can see?
Yeah, the human resource personnel for eye health is still below the required numbers, but the Ministry of Health, together with development partners, have established training programs at universities and other paramedical schools to try and address this problem of human resource.
Yeah. At what point should someone seek these services? If maybe see the eyes rubbing and there's, at what point do you think someone should seek these services?
Yeah, the issues of eye health actually start when a woman is pregnant. Before a child is born, we expect the pregnant mother to attend antenatal, where they are able to get some information about eye health. Also, when the child is born, the child is supposed to be examined before they leave hospital, so that should there be a problem that needs treatment immediately to prevent blindness, this can happen. And then also in schools, we have school eye health programs where we teach children and also screen them for eye conditions. Then also later in life, we recommend that adults should have an eye checkup at least once every year.
There are people you talked about here who are vulnerable. Just 15 seconds. Those welders, the border riders that are exposed in 15 seconds. What do you think needs to be done? Because that's
actually our theme for this World Sight Day is love your eyes at your place of work. So whatever type of work you are doing, look into the issues of your eye health.
Yeah. Yes. Okay, for time reasons, we'll leave the conversation here, but thank you so much for your time.
Yeah, thank you.
Okay. Well, Priscilla, that's what is on ground here, and a lot is being talked about, but also following up so that we are able to maybe explain better in our subsequent bulletins. For time reasons, let me get back to the studio. A very good afternoon to you and our audience.